Mich.
Yes, Stephanie.
Oh, hi, yes.
Great to meet you.
Nice
Come
to
on
meet you.
in.
Thank you.
Please have a seat.
Thank you. Thank you so much for putting me in today.
Of course. I do have to say I'm a little bummed I'm not meeting with Cassie today.
Oh.
She's been my rep for the last 10 years.
Oh, wow. Yeah, no, I know. I heard great things about Cassie. Unfortunately, I was unable to meet her before she left. I've been in training for a few months now, so, but I heard really, really great things about her.
Yeah, she was wonderful, but please tell me about yourself.
Yeah, of course. Well, my name is Stephanie. I am a Purdue grad, and I've been in the pharmaceutical field, ever since graduation, really. So it's been really great so far.
That's great. I went to Purdue. It's a great school.
Oh, yeah.
Yeah. So are you married as well and plan on leaving me when you have children like Cassie did?
Well, I am recently engaged, but I can promise you I'll be here for plenty of years to come.
That's so exciting. I thought I saw something gleaming over there.
Oh, yeah.
Your ring is beautiful.
Oh, thank you.
So I'm excited to hear about this new drug, Treximet,
Yeah.
especially since I've been prescribing GSK's Imitrex for so long.
Yeah.
Has Treximet been keeping you busy?
Yes. Actually I've been super busy with it. Like I said, I've been in training, for the last 3 months just to completely absorb myself with Treximet.
Yeah.
But GSK has really done a great thing with this product, so I'm really excited to tell you about it. This is actually my second week now meeting with physicians.
Okay.
So, which actually is what brings me here today, of course. So I want to make sure that we go ahead and address any concerns that you may have about Treximet, better familiarize you with the product, of course, so we can go ahead and get your patients the relief that they deserve from their migraines.
Yes, that's great, because I'm really excited to hear if Treximet is right for my patients.
Yeah, of course. So just tell me a little bit, what do you know about Treximet?
Well, I've done a little reading, and
Okay.
I do know that GSK has added some new active ingredients, which makes it different from Imitrex, and that's what I'm currently prescribing to my patients. So,
Right, so how would you say is Imitrex working for your patients?
for some of my patients, it gets the job done,
Okay.
it gives them relief, but
Sure.
honestly, for most of my patients, it's just not giving them enough relief. They're waiting on the migraine to go away, and once they do feel relief, it doesn't last as long as I think it should.
Okay. Are you hearing any complaints, from your patients, maybe about some aches and pains associated with a migraine, or how are their symptoms?
Yeah, I mean, all those aches and pains that come with the migraine, I really do hear about that quite a lot.
Okay, so like the sensitivity to light you hear, all that.
Yeah.
Okay. I hear you. I mean, and I totally understand their frustration. Trust me, especially when you have a migraine, you just want it to go away.
Yeah.
You're not really too concerned about anything else, until the pain subsides. So your patients that are prescribed Imitrex, we know, are getting a sumatriptan. So we know sumatriptans are an awesome ingredient to go ahead and fight migraines. But, they're kind of getting a domino effect of relief. They're waiting for that sumatriptan to tackle their migraine, kind of allowing all the other aches and pains to kind of subside as long as the migraine goes away. And that's unfortunately not really working for them, right?
Yeah, exactly. I mean, they're waiting just for the migraine to go away, but in the meantime, all that pain is causing them to feel miserable, honestly.
Right. Yeah, and I believe that's why Treximet would be great for your patients. We added an naproxen. So we have the sumatriptan, that's still a great migraine medicine. We're just adding the naproxen as the active ingredient to go ahead and fight the pain that's associated with those migraines.
Okay.
So no more of the waiting for the migraine to go away and then kind of everything else to subside. There's 2 active ingredients. One's tackling the migraine, one's tackling all those aches and pains. So they can really powerhouse, that migraine and just make it go away.
Okay, that does sound like it would be beneficial to my patients. I am wondering though, how is it to transition, from one medication to the other? I don't want my patients to go through any discomfort if they don't have to.
Yeah, no, and that's a valid concern. We just recommend that you wait about 24 hours between taking your last Imitrex to your first Treximet.
Okay.
Nothing too crazy. You kind of see that, commonly through, the practice. So.
Okay, and as far as side effects are concerned, is there anything new I should be aware of?
Actually, we really haven't had word of anything that we haven't already had to deal with the Imitrex. So just your common nausea, dizziness, sleepiness. those little aches and pains in the jaw, neck, and throat area
Okay.
that we heard about, the numbness and tingling, which all go away, most of the time as, they start to take the medicine more and more.
Yeah, that's great news. I just, I don't want my patients to have to feel worse before they feel better.
Right, of course. And I mean, that's what I'm here for as well. I want your patients to have the utmost relief that they possibly can.
Yeah.
Do you think it would be beneficial to your patients to be prescribed such an advanced migraine medication?
I do. I mean, I really do strive to give my patients, empathetic, quality, expert health care.
Mm-hmm.
And I know that means sometimes I have to move out of my comfort zone just to give them the best of what's available.
Mm-hmm.
And I do have initial concerns, as any physician would,
Sure.
recommending and prescribing such a new medication.
Mm-hmm.
But you've addressed my concerns about the side effects, but why would I need to prescribe Treximet to all of my patients? Not all of them are feeling the aches and pains that come with migraines.
Sure. I mean, I totally understand and appreciate your genuine, true concern that you have for your patient's wellness. I do encourage you, though, to prescribe Treximet to your patients suffering from migraines for the simple fact of the satisfaction they're going to get from the medication.
Okay.
We haven't had anybody really complain that it's not working for them.
Okay.
Unfortunately, we had that with Imitrex, but we went ahead and improved on that. So Treximet, would be a great medication for your patients, suffering from migraines.
Okay.
They're going to get that migraine relief as well as, relief from those aches and pains. And, the naproxen, it's not really designed to hurt, anybody, as a
Okay.
painkiller. So with that being said, we're not trying to cause pain, we're just trying to relieve it.
Okay.
And those patients that may not be really complaining about those aches and pains, it's not going to hurt them. There's really no harm in prescribing the Treximet to them.
Well, that's great, but I did look over the prices, and there is some harm there.
Yeah, well, I mean, I know we had to go ahead and, redo the pricing a little bit.
Yeah.
I made this pamphlet for you.
Okay.
So it's full of information about Treximet.
Okay.
And what's really nice, too, is that we go ahead and address some of the pricing.
Okay.
So it's about $30 a pill, and that's before, their insurance plans come into play. We've seen pretty good coverage with it so far.
Okay.
So I really think that would, help them out a little bit
Yeah,
there.
definitely.
And then on top of that, GSK, we really have been striving to make sure that everybody can get this medication, that obviously needs it.
Yeah.
So is what we did. We have some coupons in here. Feel free to go ahead and start giving these out to your patients.
Okay.
They can go ahead and redeem them, directly from the manufacturer.
Great.
As well as just, obviously just make sure that they have a prescription for it.
Okay.
So they can go ahead and get that filled. And then, of course, too, we have some free samples that you can go ahead and, give out to.
Okay.
We can make sure that it's actually working for them before they make that financial commitment, of course.
Yeah.
So between the insurance, the coupons, promotions that, GSK is, giving out, free samples and everything, do you think that the assistance would be beneficial for your patients?
I do, and the patients that I have in mind, they're really suffering from pain, and I don't think that they would mind paying a little bit more to find long-lasting, true relief, not just from the migraine, but from everything that they're feeling.
Right,
all the stuff
they
that
just
comes
want to
with
feel
it.
better. Right?
Yeah, exactly. But
Yeah.
I am concerned how they're going to feel about just being prescribed such a new medication so quickly,
Mm-hmm. Yeah, well, I mean, I know this hasn't been on the market too long. However, we have done some extensive research with the product, of course. I mean, you know what it takes to actually get something to be able to be prescribed.
Yeah.
So with that being said, I really don't think that they're going to have too much of a concern. This pamphlet, too, has tons of testimonials in here from, patients that were taking the migraine medicine before it was available.
Yeah.
So this may be something, too, that'd be beneficial to go ahead and show your patients, especially
Okay.
with meeting with them
Yeah, that would be
one-on-one.
great.
They can see this firsthand. If you need more copies, too, I'd be happy to stop by and give you some more so they can, feel more comfortable with the
Okay.
medication.
Yeah.
They value your opinion so much. They've been coming to you for years.
Yeah.
And, I really don't see it being a problem as long as, you're behind this for them.
Yeah. I mean, that is true. Thank you for saying that. But I really strive to learn everything I can about each medication, and I think that's why I've built that influence with my patients. But I really would say you've helped me tremendously here today to learn a lot about Treximet, and I feel a lot more comfortable and confident about moving forward with this.
Oh, great. That's great to hear. I did bring some samples for you today.
Great.
So I'll be happy to stop by with some more. I think I actually have some more in the car too if you need some.
Thank you.
But we'll go ahead and make sure those get distributed, to your patients.
Yeah.
And we can follow up, see how it's working for them.
Definitely.
Get some feedback from them. And kind of go from there. And this pamphlet too, of course, is my card.
Great.
So feel free to, give me a call. My
Okay.
email is on there as well. With the cell phone, office phone, whatever you need. So.
Okay. Actually, that works out great. The patients that I have in mind are scheduled to come in this week.
Oh, perfect.
So I'm going to get them started on this, and we'll follow up in a few weeks to see how everything is going.
Yeah. I'll just give you a call. Maybe after the holidays.
Okay.
We can go ahead and give them some time to get it going and see how it's really working for them.
That'd be perfect.
Oh, great.
That sounds great.
Thank you so much for meeting with me today. I really appreciate it. It was nice to meet you.
Of course. I look forward to working with you, Stephanie. Thank you so much.
Thank you.
Have a great Thanksgiving.
Oh, you too.
Thank you.